Hi everyone, good morning. It's 7:23 in the morning. Today our topic is going to be understanding miscarriage, right? So I have a patient actually just contacted me yesterday. Yeah, sent me an email and say whether I can talk about recurrent miscarriage. Because you see her sister having a problem like pregnancy loss. I don't know how many times, but she mentioned about recurring miscarriage. Right. So we're gonna talk about miscarriage this time. Now, I want to let you know that let's give an overview first. Okay, so pregnancy can be a great time of joy, yeah, certainly, but it can also be filled with worry and even sadness, especially if you have experience in previous time you have experience of a miscarriage, right? So, hi, Candice, how are you? So yeah, if you on the live now, please give me a thumbs up and say hello to me. Then please share this information in this live video to your Facebook page. We're gonna talk about miscarriage today. Just give you some information of understanding miscarriage. This is quite. You probably don't know that. It's about 10 to 15% of pregnancies in the miscarriage in the first trimester, right? So like the most easier way to get we have 3 different trimester in your pregnancy, and it's about 10 to 15 pregnancy that end up with miscarriage that in the first trimester, right? All right, we'll talk about it later, okay? So it's normal when it comes to miscarriage. It's very normal for you to feel sad, your emotion loss, like getting depressed, anxiety, and that is quite normal. Yeah, that's quite normal because we lost a child, you see. So, and while you may not hear your friend talking about it over coffee, the reason not many people want to talk about it. Yeah, not many people want to talk about this thing. Yeah. So, but you need to know that you're not alone. Because miscarriage is actually relatively common. Yeah, it's quite common, right? There's good news here, though. Most women who experience miscarriage, who will go on to have a healthy baby. So there's good news there. Yeah. So most women experience miscarriage, they end up with a healthy baby. So you will get pregnant again. But finding out the reason why you get what caused the miscarriage is important. It's important. Okay, we're gonna talk about that later. Okay. Goodness says, good morning, Szenan. Hope you have a great day. Keep up the excellent. Thank you very much, goodness. Good morning, Veronica. Nice to see you again. We have Bill Chick join us. Thank you for joining us. Now, so we have YouTube friends on here as well. Thank you for joining. Please let me know who you are and say hello to me and give me a thumbs up. Thank you very much. Okay. So, what is actually miscarriage? Okay, so miscarriage is also called early pregnancy loss. Okay, and when a baby dies in the womb, uterus, all right, before 20 weeks of pregnancy, and that's what we call miscarriage. Okay, For women who knows they are pregnant, about 10, we talk about the 10 to 15 in 100 pregnancies, yeah, in a miscarriage, 10 to 15%. So 100 people who get pregnant, about 10 to 15 of them actually experience miscarriage. So it's quite high. It's quite high. Okay. Pregnancy is a natural thing. It's not a disease. But when it comes to miscarriage, we need to find out what's causing it, what's actually causing it, because we want to prevent it happen again. There is a term called recurrent pregnancy loss or repeat miscarriage. So that means if you have 2 or more miscarriage in a row, okay, and then we'll call it as a repeat miscarriage or recurrent miscarriage. Right. About 1 in 10 in 100 women, 1%, so about 1% have repeat miscarriage. Okay, have a repeat recurrent miscarriage. Okay, most women who have repeat miscarriage, okay, about 50 to 75 in 100 or 75% or 50%, right, have an unknown cause, right? They don't know what's happening. Yeah. And most women who with repeat miscarriage with unknown cause, 65 in 100 women, 65% go on to have a successful pregnancy. So now the good news is, it's sad. Now people have miscarriage or even recurrent miscarriage. But the good news is that 65% of them had a healthy baby in the end, right? That's the good news, right? Keep on when it comes to miscarriage, it's nothing fun and nothing is good news, right? But we focus on the positive side rather than the negative side, right? So the number that I just told you was actually, it just would happen, and there's a study over there, and they read out the study. So I've seen miscarriage patient, and most women come in and I ask them, do you know what causing it? Do you get any tests? And they say no, because most doctor didn't realize what's miscarriage. Your GP, they don't understand a lot of it, to be honest, because a general practice, general doctor, this is two professional things, very professional thing, right? So your GP may not understand what's going on, and I'm here to share with you. The miscarriage is caused by things like issues with baby chromosome. Yeah, chromosome. Okay, someone keep calling me. So we need to understand what chromosomes is. The chromosomes is, let me pull it out. So we actually have how many pair of chromosomes do we have in our body? It's a genetic issue. Yeah, it does have this problem. Okay, the chromosome that we have is actually 23 pair. Okay, and which means it's 46 in total, right? In total. Hi, Kika. Now, that which means half 23 from mom, 23 from dad. Okay, this is the chromosome, and that it's been proved that they have to run some tests to be able to find out whether it's from chromosome or not, right? But sadly, if you just experience one miscarriage in here in New Zealand, which term? We're talking about understanding miscarriage. Because in Instagram, I couldn't put any topic on top. Not like in YouTube and Facebook, I can put the topic on top, but in Instagram, it just not allowed me to do that. Right? Okay, so we'll talk about more about it. Okay, so first, the first thing that causing the miscarriage is can be from the chromosome. Right? The issue with uterus or cervix. Right? Like what is the issue? What are the issue on the uterus and cervix? Septic uterus, scar tissue, or fibroids. We talk about fibroids. Yeah, that is one of the reasons that causing miscarriage, and fibroid is one of the reasons that causing infertility as well. Okay, so those two, septic uterus and scar tissue. And scar tissue, and people do DNC or whatever that, or they terminate the baby in the past, and they have to do TNC to the cervix and cervix and in uterus, then they will leave scar tissue in there. When that leaves scar tissue over there, then in the future it may cause miscarriage. Right? Hi, Alali. Nice to meet you. Thank you for joining us. So another cause of it is issues with mother's health, like hormonal imbalance, autoimmune system disease, autoimmune system disease, and hormonal imbalance, right? So infection is another one, like sexually transmitted infection, or any kind of infection while pregnancy, especially the infection is whole in the uterus, and that is very sad if you have infection while pregnancy. Okay, so it's important to get your blood test when you're pregnant, because you may tell that you there's HCG that is double every day, right? When you're pregnant, if it doesn't double it, because you may not have any sign when you start to get miscarriage. Okay, if it doesn't double it, and that's a sign that is an early sign of miscarriage, right? Or early sign of miscarriage would be bleeding as well, or tummy pain, So before tummy pain or bleeding, sometimes the blood can show on a HCG that is not doubling, and that we have to take care of it. But unfortunately, in the Western side, there is no treatment for it. There's no treatment for it. But in Chinese medicine, we have a lot of idea of treatment for it. We can help with that, So be in mind that, okay. So yeah, no matter how it happened, you may experience intense feeling of grief, anger, or sadness. Okay, you may even feel numb at first, but go on to experience a variety of feeling later on. So the emotional is the most thing that impact and hurt and retain more afterward. Okay. All right. It may take several weeks to a month or more for your body to recover for miscarriage. Okay, the timeline is individual. Yeah, depending on the type of miscarriage you experience and whether or not that you have medical intervention like DNC. Yeah, DNC is dilation and curettage, as we call DNC, which they scrape your uterus cervix to help you clean up your uterus, to pass the fetus. Now, I'm going to tell you something that what I just mentioned, all this course, okay? This is in on a Western side to talk about it, but when I mention about the GP not understand it, it's because I found that a lot of miscarriage actually related to what we call low iron. One of the big issues is low iron, and second one, it may due to clots, right? So, so I actually suggest all my patients when they prepare for pregnancy to get a blood test to test out the iron. Okay, now when test out iron, there's two things, and one is the amount of the quantity of the iron in your bloodstream. The other is we test out the iron protein. Yeah, it called ferritin. So those are two different things. Two different things. So when you take blood test, right, the iron in your blood and the ferritin are both talking about the iron quality in your bloodstream. So one is ferritin is talking about the ability of store iron in your body, right? So that's different. And the iron test is talking about the quantity of the iron in your bloodstream. Why this is so important? Why this is so important? If you watch my live video in the last few days, we mentioned about this, how the period form, what is period, okay, and why when you're pregnant you don't get period bleeding, right? So let me explain to you again. So my iron is good, but ferritin's low. Yeah, you need to build out your ferritin. Kika, you need to build out your ferritin because ferritin is important. It means that it means, so one of the simple way to build up iron and ferritin is get a pot, an iron pot to cook, stir fry your veggie. Yeah, that's one way. And for fertility, really through the food, the general eating is best, okay? And people have a wrong idea that they have to eat red meat, and that's wrong, okay? Nothing to do with red meat, right? The veggie is good enough, okay? Good on you. And the quicker way to do that, all right, especially for the iron, the amount of iron, is get a iron infusion. Iron infusion will be quicker to build up that. If you're pregnant, if you in a try to get a conceive, then I normally suggest my patient, and people think about having a time, out of time, and I suggest them get an iron infusion, right? But yeah, food is important. Eating healthy is very, very important. Okay, then let's talk about how the pregnancy happened. Okay, so we all know that the eggs and sperm meet together and become embryo. So the embryo need to implant in the uterus. sesame, cacao. Doctor said the infusion can be dangerous. Yes, any anything that will become side effects. So you need to research about the side effects and what is the risk that you're gonna take. Yeah, you're right, Kika. You're totally right. Okay, but for those women like they are 40, 41, then they are running out of time and they have low iron, low ferritin, and then I'll suggest them to get a infusion of iron because you want to build up this. It takes time. I'm going to tell her that take 3 months or 6 months or even a year to build up your body to get ready. And they say, I run out of time, you know. So that's why I said the quicker way is to iron infusion, you know. But if you're still young, I don't really suggest that. Yeah, you're right. I don't suggest that. You know. Then okay, let's talk about when the embryo need to implant in the uterus. Okay, what it need to implant a good thick lining, right? If the lining is too thick, no, too thin, not too thick, too thin, then it implant on it, it haven't got enough lining for it to implant properly. So what happened is it caused miscarriage. So now we need to find out. The reason is because the iron is too the lining is too thin, but no one know about it, and you can't check the lining. What because people naturally get pregnant, they don't go. Pregnancy is not a disease, so you won't go and get a test or whatever to check your lining first. You know, so once you lost your baby, and there is no way for you to test the lining, you know, you haven't tested before pregnancy. So how do we know that? You know, to find out this whether it's a lining issue causing it or not, we check the iron. If the iron is low, the ferritin is low, then both of them are low, or either one of them are low, then we suspect that the pregnancy, the miscarriage is it may form the thin and a thin lining, right? This is it. Okay. So what we do is build up the iron or ferritin and ferritin or ferritin to make sure that the iron and ferritin is good. Then you'll be able to get thick enough of lining. So next time when the embryo implant it or implant properly. Does it make sense to you? Now, another thing is now why iron? Because iron is the source of the blood. It's one of the main source. So you need iron to make blood. So this is what we're talking about. Okay, this is one thing. So one thing that very common that hasn't been discussed a lot. If you Google it, if you ask a doctor, they didn't know about it. They know you have low iron, but they didn't actually link to miscarriage. Okay, so first, I wouldn't suggest you try for conceive before you sort out your iron. Okay, and ferritin. Once they become normal, then your period, you have good amount of period, and then you start to try at no pain. Okay, now next thing, like for over the course of the miscarriage causes, so we talk about chromosome. and we talk about the uterus and cervix issues, right? We talk about the mother's health. Okay, so the mother health, and people talk about hormonal imbalance. People talk about autoimmune disease. What is autoimmune disease? Like thyroidism, a thyroid issue that'll prevent you get pregnant, or when you're pregnant and it get miscarriage. Okay, an infection. Okay, so I want to back up another thing that in the mother health. Okay, in the mother health, and even though in father health, why is that? Because the sperm quality is not good. And we talk about sperm quality later on. We'll talk more and more. Okay, we won't finish everything today. We just talk about understanding the miscarriage, a big picture overviews of it. Okay, now we're going to talk about the clots. So what are the clots issues? Now there's a clot test that you should do. If you like, I suggest all my patients, if they come for infertility, I say get your blood test and get your clot test. And why is that? Because you want to prevent miscarriage. It's about 10 to 15% that experience miscarriage. That's quite high. Yeah. Do you want to be that one of them? No, of course no. So if we can rule out something before you get pregnant, why not? Because wait until you get pregnant. If you're in the 15% of them, then it's going to be very sad. So we rule out potential issues. Now, one of them, we talk about lack of blood, right? Blood deficiency, right? Then we now need to talk about the clots. The clots is the blood form clots. So how they can do that easy, and it can prevent the miscarriage. And the most easy way is when, like, they probably I'll tell you, for if recurring miscarriage, if you had the first time, the second time they give you, if they don't know about the reason, what do they give you? They give you aspirin. Why? Why they give you aspirin? Because they want to make sure, they assume that the baby didn't get enough blood nourishing the womb, right? So the baby died inside of the womb. And to make sure the baby get enough blood, is give you blood thinner medication. The blood thinner medication, one of them common use is aspirin. So to thin your blood, make sure your blood is thin and easy to get to the womb to supply to the baby. So that is the way they do it. That is the way they do it. Okay, but think about it. What if your problem, the miscarriage, is not because of the clots? It's because lack of blood. And this is going to make it worse, because you thin the blood. You haven't enough blood, and you thin the blood. Just like, well, this cup of tea, not enough flavor, so I need more iron in it. But instead of getting iron, and you just put more water in it, you didn't treat it. You make it worse, and you still get miscarriage. So how do we know whether it's clot issue or not? Run a clot test. So before you're trying to get pregnant, run a clot test and run up iron in, because those two things is easy to pick up, easily to know before you get pregnant. Once you know that you have a blood clot issues, then when you get pregnant, simply take some aspirin, just a small amount, to help it move the blood. If there is any early sign of miscarriage, then take a little bit of the aspirin. Okay, this is how the doctor will do, and I do agree with that, because we're saving the baby. And little, I'm not normally agree with any medication of Western medication, But in this case, I do agree with a little bit of aspirin. It will save the baby, right? So we talk about the side effect of Western medicine or whatever, and you may think of, oh, I'm the one who against Western medicine. I'm not. I'm just telling the truth and letting you know that what is the side effect of that and how bad is that and what is a good part of that, you know. So I study Chinese medicine and Western medicines. Yeah, I study both, so I understand both. So in China, my teacher, uh, my professor, they use Chinese medicine and Western medicine together. All right, so this is how I will understand it. So I won't against anything, unless they're bad for you. All right, I will agree with that if they're good for you. All right, if they're good for you. Okay, that's it for today. We're gonna stop here. This is the overview of the miscarriage, but I just name up two things that about the clot and the iron, because a lot of doctor, if you go for Google, a lot of website, and they did mention about that. Unless you go for a Chinese medicine website, acupuncture website, and to talk um, to find some research about miscarriage, and they will talk about the blood sign, because that's common and that's very, very common. And I'll tell you what, IVF patient, and they keep get unsuccessful, and they keep testing the lining, and the linings couldn't build up, and that's very sad. And it's simple, just treat the blood, nourishing the blood, get the iron better, and then I'll tell you, some of our patients, they waiting for IVF, and they came here and we asked them to do blood tests, and we found out that they actually less blood issue, because a lot of IVF patients, and there's no reason, they couldn't find out any reason, and they say the IVF doctor told them, no, you have no fibroid, you have no PCOS, you know, endometriosis, so you're quite normal, you know, and your reason of can't getting infertility is unknown, you know, it's unknown, no one know about it. But simply, if they have low iron, and you know the iron is the source of building blood, and yes, there is a reason in there, but they didn't look at the big picture. Because why is that? Because if the IVF doctor tell you that you have low iron, you need to fix your iron and you will get pregnant, which means they lost the business. They literally lost the business, you know. So this is the one who, and when I see them, I say, well, you have low iron, and that is, and I explain how the iron's going and how it works and the lining things, and I start with, oh, okay. I said, this is your reason why you can't get pregnant, you know. So I do believe it IVF doctor in some cases, if that is a quote, if the baby, because we talk about chromosome issue that causing miscarriage, chromosome issue causing infertility as well, and you want to roll out the chromosomes problem, you know, you want to pick the right one and roll out the bad one, and we can help you as Chinese medicine, and the IVF doctor is a good one for it, you know. So I do agree with IVF doctor in some things, not everything. If when they can find out the reason why that patient can get pregnant, and a lot of time, or most of the time, is due to the iron issues, right? So yeah, we're off topic a bit. We're talking about infertility right now, but we should just talk about miscarriage, right? So I want to show you some acupressure point. The acupressure point over here, we will show you again and again, because in the next couple of days we're going to talk about miscarriage a lot. All right. So we talk about miscarriage, called the cause and overview of it. We're going to discuss how soon can you get pregnant after miscarriage. Okay, there's another topic in here, and then further on we're going to talk what is the risk of another miscarriage? You have first miscarriage, and how would it become recurrent, and what's the risk of it? Right? What happens if you miscarriage again? What happens if you miscarriage again? What tests should you run? Okay, we're gonna discuss this as well, and what else can you do? Like things to consider, all this topic, and I'm gonna give you some tips. But every time I'll give you, no matter what kind of miscarriage, okay, as high chance it is because of the lack of blood. So the acupressure point over here, it would help to build up your blood, to build up your spleen, right? So first we need to understand where is the blood come from. What is the blood come from? The blood come from your eating, your food quality. Okay, so this point can build up your blood stream. It called the sea of the blood. The point called the sea of the blood. So it can build up your blood stream, the quality of the blood. And of course, you need to have a quality food. Otherwise, if you keep pressing this, it won't help you, right? So over here, the kneecap, on top of the kneecap, so the kneecap is triangle, right? It's like this, right? So you feel the kneecap that is triangle. You feel the bone in the end of the bone in here, and in the end of the bone on the other side. Okay, on both sides. On the inside one, which means on the big toe one, okay, over here. So about 3 finger above. About 3 finger above the inside one. I don't have the best thing to show you. 3 finger above the ankle of the inside, the big toe side. 3 finger above that, and then you directly above, and your finger go and press it. If you can get a tenderness spot, and that's it, and give it for about 1 minute every day. And this point can build up your blood system, the quantity of your blood, and through nourishing, improving your spleen function and stomach function. All right, build up your spleen function and stomach function. When you eat, it can build the blood quicker and easier. Okay, so this is the function of it. And this point is great. Some acupressure point, like level 4, last sensation 4, you can't use it when you're pregnant because it can cause miscarriage. We use it to help patients to bring the baby, to stop the pain when they go for labor. And so this point you don't use it. But this acupressure point, you can use it anytime you want. Preparing for pregnancy, while pregnant, anything with pregnancy problem, that you can do that, because this is nourishing the blood, right? Get more blood to prevent miscarriage as well. Get more blood to help you get pregnant as well. Okay, so this point is very safe for everyone, anyone. You can just do it yourself, right? Or you can do Moksha. We're gonna talk about Moksha another day. Okay, stay awesome, and I love you all. I'll see you tomorrow morning. See you. Bye bye.